Good morning, everybody. Now, the topic what I am going to deliver, that is the various pathological investigations and its clinical significance about the diabetes mellitus. Now, I hope that up to these last 3 days, you are focusing all your studies about the diabetes mellitus. Am I right? So, different type of the aspect you have already studied it. Now, here the opportunity is being given to me that to tell you some aspects about the investigations, that what sort of the investigations you doctors you are insisting to get it done for your patients. Am I right? So up to this time we have to just know the things that if I will bother you about what I am going to say, that you might have studied the properties of the carbohydrates in your first year homeopathy. Am I right? Yes or no?
Yes.
Okay, how much it is very difficult to say anything about it. So, how now I am going to start making this lecture. See, first to 20 slides will be there. They are going to tell you that what is the importance of regulation of the blood sugar level. Anybody is able to tell me what is the normal blood glucose level? Fasting one? Okay. Then you should know about what is the normal range of the post-prandial or post-meals. Then you should know about what is the importance. So you may be knowing that suppose if you want to rule out whether the person is diabetic or no, some sort of the anesthesia is being given, it has to be given or like that. So you are going to get the random blood sugar also. So all these points I will like to cover, but you should know that whatever the investigations you are asking from any type of the laboratory, because as the number of practicing doctors is increasing, in the very same manner, in that proportion, the growth of these laboratories is also increasing. So you must know, you should be aware that what sort of the laboratory setup is required for getting or obtaining the authentic type of the reports. So that will be your responsibility now. Are you understanding this? So simply, see, anybody can do any type of the investigation, but the laboratory in which what sort of they are having the expert hands with them, and what sort of the equipments they are going to have, whether all sort of the facilities they are going to have with them in that laboratory, everything has to be studied by you, because the responsibility goes with you. Now I will just give you the example that my laboratory is there. I am having the experience of the 30 years or so, but we are having the collaboration with Dr. M.S. Ajinkya, who is the eminent pathologist. So the few tests what I am able to do, certain tests I am not able to do, I have to have the such type of the collaboration with him. Now not only that, doing these tests for the thyroid functions and like that, we have to depend on the metropolis or like that. So that is a big thing, that is a big chain is there, and there we are supposed to take the different type of the help from each and everybody. Is it clear? Now I will start the thing directly now. See, I ask you that what do you mean by the regulation of the blood glucose? Now blood sugar, that you know that 2 alpha, 2 beta, and that is the D-glucose. So that is whatever you are going to have the blood glucose, what you are going to say, that is the thing. Now this concentration that will remain, that is 100 milligrams what they are expecting, and it has to be controlled. Now what is the controlling mechanism is there, that everybody is aware of that fact. What is that? The main role is being played by the insulin. Is it clear? Now you have to understand that it can rise up to 140 to 150 in that range. So glucose is added in the blood by which type of the mechanism that is mentioned there. Is it clear? That is by the absorption from the intestine, by the glycogenolysis and glyconeogenesis. So breaking down of the glycogen and making the glycogen, that is the terminologies what they have mentioned there. Now from the blood circulation, glucose is reduced, it is also reduced. Why? Because whenever you are going to do day-to-day activities or any type of the function, you will require the energy, and that energy from where you are going to get? That is nothing but the source of the glucose. Now this is the regulation has to be done appropriately. Now the balance of these processes maintain blood sugar level in normal limits throughout the day. Okay. Now the steady blood glucose level is significant for the nourishment of the individual tissues, and particularly the functions of the brain are dependent on normal blood glucose levels, since it has particularly no reserve for the oxidizable type of the carbohydrate. So this point you have to keep in your mind. This is very important aspect. Now here the balance of the process keeps the blood sugar level, that is the what just now one or two people they have quoted, that is 70 to 110 throughout the day. Average what we are going to have the 100. Now the liver, how the regulation is being done? That is the involvement of the liver. Now how that liver is involved there? That is uptake of the glucose from the blood, conversion of the glucose to the glycogen, then release of the glucose from the glycogen, and conversion of the pyruvate to the glucose. All this mechanism is being done by the liver. Now not only that, there will be the muscle glycogen which do not contribute directly to the blood sugar. Glycogenolysis in muscle produces lactate, which is converted to the glucose in the liver. Now the kidneys exert a regulatory effect by reabsorption of the glucose by the tubules completely when blood glucose level is below 150 to 170 milligram per deciliter. This is what we are going to call it as the threshold value. Now in the physiology that you might have studied the functions of the kidney, and there you will try to recollect. So what do you mean by this renal threshold? Now this is the important aspect. In the case of these normal individuals, blood glucose level does not rise above its threshold level. It is due to the role of the following hormones. Now first one, what I told, very important hormone is nothing but the insulin. Now if we are going to go on studying the aspect about the pancreas, so in this pancreas there will be the islets of beta, Langerhans, then there will be alpha, beta, delta, and the P type of the cells are there. So at present we are concentrating only on the insulin, and it is the hypoglycemic hormone secreted by the beta cells that everybody knows. But what exactly this insulin is doing? By increasing the transport of glucose across the cell membrane. Try to get the idea of the physiology. Okay. Now by promoting the glycolysis, by increasing the glycogenesis, and by decreasing the glycogenolysis. So these are the aspects what the insulin is able to do. Now these beta cells, pancreas, are capable of the measuring the blood glucose level. Now what is happening? This mechanism is also important. That is, the first stage occurs within 10 minutes, during which insulin molecules are released from the proinsulin molecules stored in the secretory granules of the cells by cleavage of proinsulin molecule and with the release of the C peptide. Please remember, various clinical investigations when we are going to start talking about it. So this is the part where we are going to ask for the insulin level. We are going to ask the level of the proinsulin, and we are going to talk something about the C peptide also. So where exactly that is we are going to use, that is different. But you should know. Now with the rise of the blood sugar level during the second stage, more amount of insulin is manufactured by the beta cells of the pancreas, and the amount of the insulin release depends upon the rise in blood glucose concentration. Second phase lasts until glucose levels drop to the normal level, that is in the 90 to 120 minutes. Is it clear? Are you understanding this? Now, as a result of unavailability of the glucose to the cells, so what are the features? That is, all these speakers, they have all told you that what are the different phases are there, how you are going to start knowing the aspect, how you are going to go on stamping whether that person is having the diabetes or no. What are they? That is the polyphagia, that is extreme hunger. Okay, then there will be the glycosuria. It means that the occurrence or the presence of the sugar or the glucose in the urine. Then there will be the polyuria because of the osmosis, that is the whenever there will be more and more glucose